Angel, let us study muscles of the abdomen together. So the mnemonic breakdown for the abdominal muscle is tiger in red, evening quilt. Tigers, the breakdown is tiger stands for transversus abdominis. In is internal oblique. Red is rectus abdominis. Evening is external oblique. Quilt is quadratus lumborum. Okay. All right. So let's start with rectus abdominis. The origin of rectus abdominis, as you can see, these bellies, the red ones, are all rectus abdominis, right? The famous call is abs. Rectus means straight, so straight abdominal muscle. There are a pair of segmented skeletal muscle on the ventral aspect of person's abdomen. The paired muscle is separated at the midline by a dense connective tissue. It's a band of dense connective tissue called as linea alba, right? This one here is umbilicus. This is linea alba. And this here on the side is linea semilunaris, right? So on lateral margins, you can actually see this particular muscle is very well defined on all the sides. All right, so rectus abdominis muscle is contained in rectus sheath, which consists of aponeurosis of the lateral abdominal muscles, right? So each rectus abdominis is transferred by bands of connective tissue called tendinous intersections. These particular lines that you see are what you call tendinous intersections, which interrupt into distinct muscle bellies, right? So as you can see here, there's a muscle belly, muscle belly, muscle belly, muscle belly, right? As you can see, there's striations, right? All right, so origin is pubic symphysis, pubic crest. Insertion is xiphoid process. Costal cartilages of ribs 5, 7. Innervation is intercostal nerve T7, T11. Then we have subcostal nerve T12. Blood supply is inferior epigastric and superior epigastric arteries. Contribution from posterior intercostal, subcostal, and deep circumflex artery. And trunk flexion. The function is trunk flexion, compress abdominal viscera, and expiration. Study external oblique now. The origin of external oblique is external surface of ribs 5 and 12. Insertion is linea alba, pubic tubercle, anterior half of iliac crest. Action is bilateral contraction, trunk flexion, compresses abdominal viscera, expiration, unilateral contraction, trunk lateral flexion, ipsilateral trunk rotation, contralateral, so you rotate either direction. Innervation is motor innervation is intercostal nerves T7, T11, subcostal nerve T12, right, and the sensory is iliohypogastric nerve L1. Right, the blood supply is lower posterior intercostal artery, subcostal artery, deep circumflex iliac artery. Right, so abdominal external oblique muscle, also external oblique muscle or exterior oblique, is the largest and the outermost of the 3 flat abdominal muscles of the lateral interior abdomen. Right, so as you can see, this part here is the external oblique muscle. Right, you can see that here as well. Right. Internal oblique, as you can see, this part here is the internal oblique. Anterior two-thirds of iliac crest, iliopectineal arch. Thoracolumbar fascia is the origin. Insertion is inferior borders of rib 10 and 12. Linea alba, pubic crest, or pecten pubis via conjoint tendon. Action is bilateral contraction, trunk flexion, compress abdominal viscera. Expiration, unilateral contraction, trunk lateral flexion, ipsilateral. Trunk rotation ipsilateral, right? So trunk rotation ipsilateral equal on both sides, right? Okay, innervation, intercostal nerve T7, T11, subcostal nerve T12, iliohypogastric nerve L1, ilioinguinal nerve L1. Blood supply is lower posterior intercostal, subcostal arteries, superior and inferior epigastric arteries, superficial and deep circumflex arteries, posterior lumbar arteries, right? Abdominal internal oblique muscle, also internal oblique muscle, or interior oblique, is an abdominal muscle in the abdominal wall that lies below the external oblique muscle and just above the transverse abdominal muscle. All right, so transverse abdominis. So the origin is, as you can see, this particular area is the transverse abdominis. As you can see, the hole. Okay, so internal surface of costal cartilages of ribs 7, 12, thoracolumbar fascia, anterior of 2/3 of iliac crest, iliopectineal arch, right? So ribs, transverse abdominis is ribs 7 and 12 origin. Insertions linea alba, aponeurosis of internal abdominal oblique muscle, pubic crest, pectineal line of pubis, right? Action is bilateral contraction and unilateral contraction. Innervation is intercostal nerve T7, T11, subcostal nerve T12, iliohypogastric nerve, which is L1, ilioinguinal nerve, which is L1. Blood supply is lower posterior intercostal subcostal arteries, superior inferior epigastric arteries, superficial and deep circumflex arteries, posterior lumbar arteries. A transverse abdominal muscle TVA, also known as the transverse abdominis transversalis muscle, and transversus abdominis muscle, is a muscle layer of the anterior and lateral, front and side, abdominal wall deep to the layer below the internal oblique muscle. It serves to compress and retain the contents of the abdomen as well as assist in exhalation. So it also helps in exhalation, right? Quadratus lumborum. So quadratus lumborum is informally called QL, is a paired muscle of the left and right posterior midwall. It is deepest abdominal muscle and commonly referred to as back muscle. Each muscle of the pair is an irregular quadrilateral in shape, hence the name Quadratus lumborum. It can also be considered as a continuation of a transverse abdominis. Okay, the origin is iliac crest, iliolumbar ligament, inferior border of rib T12. Rib 12, transverse process of vertebrae L1, L4, innervation is subcostal nerve T12, anterior rami of spinal nerves L1, L4, blood supply is lumbar, median, sacral, iliolumbar, and subcostal arteries. Bilateral contraction and unilateral contraction, right? Fixes ribs 12 during inspiration, trunk extension, lateral flexion of trunk, which is ipsilateral, so equally on both sides. Alright, so this happens to a superior view of transverse section of anterior abdominal wall, superior to the umbilicus, right, to the navel. These are the bellies we spoke about, the abs, rectus abdominis, right? So if you're looking from above, superior transverse, okay? So this area here is superficial, right? So that's rectus abdominis. This here is a rectus sheath, right? We just studied that abdominis rectus abdominis covers in rectus sheath. This here is aponeurosis of transverse abdominis. This here is subcutaneous layer, right? This is the skin. Aponeurosis of internal oblique and aponeurosis of external oblique, right? So we are going from rectus abdominis, right, to external oblique to internal oblique, and then we are going to transverse abdominis, right? There you go. So this one's transverse, this is internal, this one's external, right? And here are all your rectus abdominis. More or less, rectus abdominis, as you can see, it acts as a cushion to the abdomen, right? And that here, this particular part is linea alba, the line, right? Because it separates each and every rectus abdominis into bellies. You can see 1, 2, 3. They are all the bellies, right? Okay. Posterior layer, anterior layer, rectus, linea alba. Okay, so we cover everything. Alright, so that was it. Muscles of the abdomen. If you really like this video, please subscribe, like, share, comment, and let me know how you like the mnemonic that I just gave. Thank you. Bye.